morning, good afternoon, everyone. Just opened up the webinar, so we'll give people just a minute to join, and then we'll get started. Can see a few more people joining, which is fabulous. And in the interest of time, I think we'll kick things off. So welcome everyone to the first 2023 Virtual Patient Engagement Open Forum session. As many of you know, the Patient Engagement Open Forum, or PEOF, is the multi-stakeholder event for shaping the future of patient engagement. We're really excited to have all of you here, and please feel free to say hi and hello in the chat. Let us know where you're calling from. We'd like to see the countries, the towns, the regions where you're all dialing in from, and would love to say hello for everybody there in the chat. I hope you're ready for a great panel discussion and prepared to roll up your sleeves and really contribute to our conversation and the co-creation activity that we have planned for today. Next slide, please. And so my name is Haley Chapman. I'm a Senior Program Director at the Synergist PFMD, and it's my pleasure to moderate this session called Better ESG is Made with Patients, a Pathway to Sustainability. In my opinion, what we'll discuss today is a massive opportunity for the evolution and the advancement of patient engagement around the world. Not since regulatory agencies such as the EMA and FDA has there been such a great opportunity for influence over patient engagement activities. The regulatory community has certainly supported in terms of setting guidelines, establishing advisory committees, and encouraging health science companies to prioritize the patient perspective. But now we have another great opportunity. Today, we introduce you to the next key patient engagement influencer, the investment community. And just imagine the strength of that potential for the influence and where the investment community sits in terms of decision making. We have a great opportunity to really advance patient engagement activities, and our objectives today certainly look to providing some additional insights and information for you about that. One of the first things we'll look to do is raise awareness and understanding of ESG. And ESG may be a completely new term to many of you. Perhaps some of you don't even know what it stands for, and that's perfectly okay. We welcome you to this conversation, and we'll certainly take a deeper dive into what some of these terms mean and providing some more context to it. We'll look to identify the benefits of this type of collaborative engagement for the value for the patient community, and how collaborating with the investment community and industry can really help to think about influencing patient engagement activities. We'll look at insights, and we'll also hope to inspire the health science companies to make patient engagement a central component of ESG and sustainability strategies. Next slide, please. So with all of our panelists and all of you, we'll explore these collaborative opportunities between the patient community, the investment community, and looking at industry as well, to think about how we can really work together to improve patient outcomes and also generate sustainable value for investors as well too. I'm really proud to be able to share with you the speakers and our panelists today. And I'd ask each of them to take a minute to share a little bit about themselves, the context or the perspectives that they're bringing to the table, and also to address why is this an important discussion and what would you like to achieve today? So Nicola, if I can turn it over to you first, the floor is yours.
Of course, Haley. Good morning, good afternoon, everybody. I'm delighted to be here today. I'm the former Secretary General of the European Patients Forum. I was a founder board member of PFMD and also the coordinator of EUPATI when it was still an innovative medicines initiative project over 10 years ago. So I'm especially pleased to be here at this patient engagement open forum with the three organizations. I'm now running a small company that is actually focusing on health and engagement, but is also looking at some of the other sustainable development goals, which makes ESG particularly interesting for me. Why is today's discussion so crucial? I think, as you've said very eloquently, Hayley, this is a new frontier for patient engagement. We can really go to the next level by entwining patient engagement and ESG. And what I'd like to see us do today is to really unpack how patient engagement and ESG principles, criteria, strategies, and commitments are inextricably linked. But also, I think it's going to be really exciting to delve deeper into the role of the investor as another key stakeholder to work with and for patients and our communities.
Fabulous. Thanks, Nicola. Wonderful to have you on board here. And you've provided a great segue to our next speaker and panelist as well, too. Joep, can I ask you to introduce yourself as well?
Absolutely. And thanks, Hayley. And good morning, good afternoon, and good evening, actually, if I saw the chat correctly. Great that everybody's joining. My name is Joep Myers. I work for an investment firm called Gilda Healthcare. I will summarize our mission by saying we focus on backing companies that can provide better care at lower cost. Now, why do we feel that patients are essential in that? Well, who really decides what better care is? We thought about that long and hard, and as I will elaborate on, I'm quite convinced that people who are living with a given disease are probably the best people to guide us on this journey. So I very much look forward to this panel, and I'm excited to be part of it. Thanks, Hayley, for organizing it.
Thanks very much, Joep. And I think there's a number of our participants that will be very interested to hear the perspective that you share as well, too. And as you've rightly said, I see people entering where they're calling in from in the chat. And so great to see the representation from Europe, from a number of companies. I think as well, we have some colleagues here from Japan that have joined as well, too, and also from North America. So great to see everybody's involvement, and please do say hello if you haven't already. So certainly not last, but certainly not least, Loda, I'd like to turn it over to you as well, too, to introduce yourself and also address what you'd like to achieve in this discussion as well, too.
Well, thank you, Hayley, for the kind hello, and hello, good evening, good morning, good night for some of you. Thank you for being here. Just Hayley said, I'm here because I really think this is a unique opportunity for all of us on the line. After my career in the industry, which spanned over 3 decades, I actually went and explored a new ecosystem, if you may, which is that of the boards of companies. And I went to study it and got my certification. And as part of this came my discovery, because I didn't know it as long as I was in the industry, of what is ESG. And so the purpose today is to make you share in my excitement of what ESG is, and in particular of what it can mean to the patient community and to making things and solutions with patients. Because I really do believe that, like Hayley said, this is a step, a new chapter that opens for all of us. I'll keep it to that. Thank you.
Fabulous, Loda. Great to have you with us, and certainly really interested to hear your perspective as well, too. As we move on to the next slide, as I've mentioned, that this is an active participatory workshop. And so our first question for all of the audience and the participants out there as well, too, is can you share with us what your reason in joining today is? And so you'll see that the link there, slido.com, and then you can answer with the code that's provided, and just providing some input into why you're joining today. That might include something like just to gain a basic understanding of ESG. What are we talking about in terms of ESG? How about expanding and exploring a little bit further based on your current knowledge and understanding of ESG? It might be to think about what is the link that we're talking about as it relates to patient engagement, ESG, sustainability, the investment community, and how do all those pieces fit together? And then finally, it might be thinking about what does this mean for me as a stakeholder in this? What can I actively do and take from this webinar for next steps, or to have conversations within my organization about how we might explore this further? So we'll just take another 10, 15 seconds for people to provide some responses in the Slido, and maybe another 5 seconds, Diana, and then we can share the response. I can see there's a number of people typing in. And so let's see what people have shared with us. So looking to see, so discovering more about ESG, expanding knowledge, understanding the different stakeholders' perspectives. And certainly I think that's what we will learn today from the panelists that we have on board. Working in patient engagement and wanting to learn more. What does this mean? As we've all commented, this is a new area to explore, something different, something a little bit innovative as well too. So let's see how we can explore this together. Any further comments there? Learning more about ESG? Great. I think we've got a great session planned. And if we can go back to the slides now, and thanks everybody for sharing your input in terms of why you're joining. But when we look to the agenda, just so everybody's clear on how this next hour and a half or so will work, is that we'll hear from the speakers themselves. Everybody will have about 10 minutes to present, provide some new information to provide their perspective as well too. We'll have some time for a Q&A, and so I encourage you to provide your comments in the chat, but the questions specifically for the panelists, if you could enter those in the Q&A, you'll see that at the bar at the bottom of the screen. And then we move to our co-creation session, where we really will ask for your input, your participation in answering some questions, helping us to better understand what are the needs, what are the perspectives, what are the challenges that we might be faced as we look to this exploration of collaboration. And then finally, we'll take a few minutes at the end to wrap it all up and discuss key takeaways and potential next steps as well too. So a few administrative tasks as we prepare for this too, and just what we ask before we get started, be present and engaged. Clearly, I see that we have a very engaged group as I look to the chat and see all the people that have replied about where they're from, saying hello to everybody. So please keep that up in the chat. Provide your comments, provide your feedback. It would be great to hear. As I mentioned previously, if you have a specific question that would like to be addressed to the panel, please enter that in the Q&A. I think as you're aware, the session is being recorded as well, but let's really come together as a community here to make this workshop, to make this session really dynamic and really interesting. So counting on our panelists with our support, and certainly on all of you out there as well too, to have a really interesting discussion and reflection on this. On the next slide, thanks. This is just, again, referencing the Q&A. I know I've said it a couple times now, but questions in the Q&A and the feedback or comments in the chat would be terrific as well, too. If you see a question in the Q&A that resembles something that you'd like to ask, please don't worry about typing it again. You can just vote on that question so that we understand it's coming from multiple people as well, too. So, one last question here for all of you before we turn to our panelists, and that is to really gain an understanding as to the audience members that we have here with us. How would you describe your understanding of ESG? And you'll see that when you click on the link there and enter the number, that it really is a multiple choice question. And so the first response would be, I'm very familiar with ESG. I know what it stands for. And even beyond that, I understand its impact on business and society. That's option number one. Option two, I've heard the term ESG before, but I don't really know what it means. So I'd like to understand it a little bit further. Option three, I have a basic understanding of the ESG and its importance in investing. And then finally, the last one, ESG, is that some kind of new technology? Meaning that this is a brand new term, you're not familiar with it, and would like to learn a little bit more about ESG and taking a deeper dive into some of the topics that we'll discuss today. So if I can ask people to respond to our question again so that we understand the context and the perspectives that we'll be sharing today, that would be great. Just leave it another couple of seconds here. And Diana, maybe you'd like to show the results now. Fabulous. So we see that I've heard the term ESG before, but I don't really know what it means. Okay, and so we've got a base, a foundation of knowledge that we can certainly build on there. Some people very familiar with ESG, and again, some people a basic understanding, and then a few people with ESG. Is that some kind of new technology? I'm not sure if I can see it on the screen there. There we go. Okay, super. And so it looks, there we go, thank you. It looks like there's 10% of the audience as well too, looking for a real understanding and definition of what ESG is. And so that's a perfect opportunity for me to turn this over to Nicola, who is our first speaker, and will share with us a little bit more information about what exactly we're talking about with ESG and helping to provide a perspective from the patient community as well too. So Nicola, I'll turn it over to you. The floor is yours.
Thanks again, Hayley. So I'd just like in the next few minutes to go through some basic concepts linked to ESG and also through the lens, of course, of patient engagement. Next slide, please. So let's step back for a moment to look at how the value of patient engagement is typically understood. It's often understood in terms of reducing product development times, the product development phase, cost saving, improving the opportunities of market access, and so on. Really, really important stuff. But this is mainly from the perspective of industry. It doesn't actually provide a more aggregate, holistic view of the impact of patient engagement. And perhaps this is the time to change the narrative through ESG. Next slide, please. So let's talk about ESG, environment, social and governance, criteria, strategy, commitment, principles. If we look at the environment, that might be climate stability, it might be water management. In the social sphere, it might be a company's commitment to diversity, equity, and inclusion. When it comes to governance, it might be a company's commitment to transparency and the way its excellence around corporate governance, for instance. These ideas, these principles, these criteria around ESG are quantifiable and prioritized. They're assessed, measured and tracked, and based on companies' ESG strategy and public commitments. And importantly, investors are increasingly applying these non-financial factors as part of their analysis. Alongside that, there's a growing trend to reconnect the purpose of industry to really engage deeply with patients. So this, of course, presents a key opportunity to integrate patient engagement into companies' ESG's approaches, strategies, and commitments. Next slide, please. And of course, investors are different. Investors in the community will be driven by different factors. And looking at this visual, we can see on the far left, investors who use ESG simply to mitigate risk for their investments. And on the other side of the visual, we see companies or investors that are really seeking comprehensive impact investment where ESG metrics are fundamental to their investment choice and decisions. And then we have investors that are somewhere in between those two extremes. Classical investor information, of course, is still there and still really important, but the big message here is the company's impact on environmental, social, and governance elements is increasingly important for investors' choice and decision making. Next slide, please. This slide illustrates the multitude of tools out there to measure and report ESG commitments. And actually it paints quite a complex and fragmented picture. And arguably moving forward, these could potentially be streamlined to enhance transparency and comparability across companies and organizations, perhaps even ultimately through the lens of patients in the health sphere. Next slide. Let's look briefly at the steps taken to develop a robust ESG strategy within a company. An initial materiality assessment is conducted, and I'll talk about that in a moment. This establishes a baseline upon which ESG goals are defined carefully. The company will look at performance opportunities and gaps and analyze those carefully and develop an ESG plan. KPIs, key performance indicators, will be attached to that plan, and the plan will be implemented, and the company will report on an ongoing basis with regard to the achievement of those KPIs. So that shows you, in a sense, the cycle in terms of developing and implementing an ESG strategy within a company. Next slide, please. Materiality assessment and double materiality means what is material or what is actually fundamentally important to a life science organization or company on the horizontal axis, and what is important to patients and society, which is the vertical axis. And if we move to the next slide, clearly goal is to be in the part of the cone highlighting maximum impact. So value creation for the company, but also crucially for patients and society. Let's look more closely at a real example. The company Edwards double materiality assessment. Next slide, please. Now, Edwards was an early adopter. They completed their double materiality assessment several years ago. They looked at what is really important, what should be prioritized, and consulted with many internal and external stakeholders, including patient leaders, and then charted that perspective, those perspectives accordingly. And this is illustrated in the matrix. And as you can see, patient engagement ended up on the very top right of the matrix, that sweet spot, reflecting high impact on business, but also high impact on patients and society. Only one other example of such positioning exists in pharma with Astellas. But message here is, if the C-suite and more generally the higher echelons of the life sciences sector recognize patient engagement through their ESG assessment as a top priority, this will be a major tipping point for our patient engagement movement. Next slide, please. Coming back to the narrative of patient engagement, we've developed clearly evidence for a single product through the life cycle of medicines and across a single organization, but we've not yet articulated the intrinsic value of patient engagement for all stakeholders and society as a whole, which in turn creates a virtuous cycle or a circular approach to investment in innovation. Next slide, please. Looking at the life cycle of medicines and patient engagement at every step, creating impact and value incrementally, embedding this in ESG will deepen understanding of patient engagement as mission critical for a company, a strategic imperative for a company, but also as a major societal imperative as well. Next slide, please. And we've seen some companies are positioning patient engagement as a top priority. Why? Patient engagement amplifies the achievement of ESG commitments. Companies who engage with patients can deliver better patient and societal outcomes. It informs priority setting and decision making, the value proposition of a company shifting from risk to opportunity. And it strengthens the patient community's leadership role, its agency in healthcare decision making. So thank you very much for listening. I hope I've been able to get across the core ideas around ESG and its importance. We really believe anchoring patient engagement in ESG is the next frontier. So may I now give the floor to Joop for an investor's perspective. Please, the floor is yours, Joop.
Many thanks, Nicola. And again, it's a pleasure to be here. Joep Myers. I'm an investor with Gilde Healthcare. On the next slide, which is our cover slide, you can see actually this still keeps on amazing me. So it's a bit of resilience. If you look carefully, the climber here, of course, misses a leg. This is a real picture, by the way. On the next slide, which I will not cover, it's something I need to show. Next slide will introduce us. Gilde, just because I've always noticed that when I speak to different stakeholders, the investment community is typically not that well known, and I think that's largely on us. I think investors have been quite passive in this debate. I'll talk a bit about that a bit more. So who is Gilde? I'm not going to cover all of this. This is the usual stuff we do when we introduce people to our fund. Let me suffice to say we're one of the larger investors in Europe. All we look at is healthcare. We define that as therapeutics, digital therapeutics, and medical devices. We've raised a number of funds. We have some money under management. And the key message here is something I said in the beginning, and this sets us apart from many other investors, in my opinion. We have an exclusive focus on companies that can generate better care at lower cost. And this is a key topic for the discussion today. I'll talk a bit about that as well. And what it says above it, that you don't have to be a lawyer. I'm not a lawyer, I'm a molecular biologist by training, if you go back far enough. We are an SFDR Article 9 fund. What that means for a non-lawyer, I'll give you my very simple interpretation. That means we're under a magnifying glass. So we cannot just say we do better care at lower cost. We actually have to show what we do, how we do it. We have to quantify this where possible. Now, on the next slide, I will not dwell on this, but why would any investor focus on better care at lower cost? Well, the better care part, I think, is obvious. There is, most diseases cannot be treated adequately today. The incidence of many diseases is rising. We have aging populations. We know all of this. But then the better care element of it is, as I said in the beginning, who really decides what better care is? And this is an integral part of our ESG and impact strategy. Again, that would be people living with a disease. Of course, we also talk to medical experts, but we also talk to patients a lot. Let me give you an anecdote as to how we got to this. There was a time where, frankly, I would disregard the patient perspectives. It's been a few years, fortunately, but somehow it didn't dawn upon me that this would be important. And then I was doing an assessment of a company that was developing a treatment for a progressive form of blindness. So these are young people, kids who develop this disease, and their vision slowly goes down to zero. Horrible disease. And so we were shown a therapy, and what the therapy did in very few kids was actually, these kids could again, see, and they would test that by making the kids walk in a maze. And in this maze, there were obstacles, and one eye was treated, the other one was not treated. And you could see with the untreated eye, these poor kids would bump into everything because they couldn't see it. With the treated eye, some of these kids would just clear this course. We were like, wow, this is amazing. And the medical experts were telling us this is really quite something. And I'll never forget this, I spoke to a lady who represented that patient community. And she said, yeah, that's interesting, but there's actually quite a bit of fear in our community for this thing. We've heard of it, but we're quite afraid. I'm like, why would that be? And she said, well, remember, these are kids who were born seeing and lost their vision. Now, if all we're getting is a restoring of vision, which then wanes again, you cannot do anything worse, i.e. the long-term effect of this has to be known. And otherwise we're going to be quite, you can imagine then and there, that was the eye opener for me, like, wow, okay, yeah. So this is something that has always stuck with me as a very powerful message. And so we as investors now, we actively engage in every investment that we do or that we are considering. We are asking the patient community, what is important to you? What are the shortcomings of current standard of care, and what is important to you? On the next slide, I've summarized a little bit, and this is very busy. I'm not going to go into it. It's a bit of a technical side. ESG has a lot of elements. You have to scan a lot of different things. You look at things you don't want to back. You see in the right corner, like gambling, tobacco. You look at whether businesses are run appropriately. We actually do this by sending our companies a large questionnaire, asking them a lot of questions. This is one side of the ESG side. Quite a few funds do this. Now on the next slide, I'll show you what's exclusive as far as we are aware to Gilde. Two things. So firstly, we engage and try to engage with the patient community in a very broad way. Again, we ask them, what is important to you? And again, I've been in many instances where the feedback that we get from patients is at least complementary to what we hear from medical experts. And then we try to incorporate that. Most importantly, the companies that we back, we can be educated. We also educate our companies so that they can at least be aware of what's going to be important to people who actually will receive the payment, the treatment at some point. Then we also engage with the broader stakeholder community. So we have people from the regulatory side helping us, from the payer side, and the health technology assessment side. All of this is meant to be an investment strategy that realizes better care at a lower cost. And you can imagine we're investors. There's a few things that we're good at. There's many things that we're not so good at. So one of the things that we did at the end of last year, we established a council, which is on my last slide. And I'm very proud and humbled by some of the people who are joining us in this effort. You see their pictures and their resumes here. It's led by Guido Razi, who probably many of you may know as a former director of the European Medicines Agency. It has people like Carol Longson, who used to be at NICE, I guess one of the most famous HTAs. We have David Harry, who many of you may probably also know, because he was in the patient working at group, and he's very much involved with EUPAT Advocates, other organizations. So these people are all people, in my opinion, who don't need to show their value or their knowledge to anyone anymore. They have been extremely generous to support us in our mission. And what they do is, for every company that we back or every investment we consider, these people are involved. They help us assess what is better care, what is lower cost. But then also, once we invest, we actively engage these people to interact with our companies, because at the end of the day, resources are finite. Our mission really is to back companies, again, better care, lower cost, so that if these products that the companies develop make it, they're going to be needed on the patient side, and they're going to be accessible. I also feel, and I know I have another minute and then I'll stop, quite often some of these medicines have been launched at crazy high prices. I remind you, I am an investor, but if at the end of the day, innovation is not accessible to patients, then why in the world are we doing it? And this is something that we take very seriously at Gilde. I'm very pleased to be part of this panel, and very much look forward to the Q&A later on in the session. And with that, I'll hand it over to Lode.
Wow. I need a moment to let this sink in. Joep, this was really, really good. So yes, back to the broader topic of ESG after this very, very inspired view from the investment community. Because you may say, wait a minute, I'm from a company or an organization, we don't need Joep's money. Good for you. But the reality is also that ESG is more than an opportunity. It is actually a new obligation. And that's why you've heard about it. It's a new reporting obligation for all non-profit companies in the Western world, at least. And it's going to expand. So it's an obligation. It's coming our way. And it's called now non-financial performance reporting. Why? Because ESG, those three dimensions that Nicolas so well explained that you practice and practice, they are indicators of what? They're indicators of how good your company will perform in the future, which of course interests investors, but also society, and also how sustainable it is beyond just the finance. So and that's why it's so important and why it is a reporting. So I'll quickly give you a perspective from a very big helicopter view. Let's go to the next slide. The good way visual to see where it fits in is look on the right. You already know your strategy whether that's of your patient organization, your medtech company, you know that. That's the business. That's how you intend to stay in business. And then at the bottom right, almost all companies today have core values and purpose statement and all of that. Well, ESG is an overlapping third dimension, right? And taking that together is really describing what the company is about and how sustainable it is. Next, please. Now, if you look at pharma, Nicola already gave the beautiful example of Edwards. And I took the trouble in preparation for this meeting to actually read the ESG pages of the top 10 companies. I'm not going to name them, we all know them. And you know what is true? All 10 of them already are very active on ESG, but they all also started very recently because this is a new obligation. So don't feel ashamed if you didn't know what this was about. This is really new. Some of the top companies have only made one annual report so far, and the maximum is a few. So it's really new and it's a new opportunity. Now, what's also interesting is that of those 10, 3 already have included what they call either patient centricity or patient engagement into that double materiality assessment in different places, but it doesn't matter, it's there, right? But today, when it's there, it's often because the people have realized how important for the business society is to understand patient needs. There's not yet any company in those top 10 that includes patients as the decision making. Next, please. Now, that means that we have a potential here. And that's what Haley said at the beginning. We have the opportunity to really shape this, all right? The best way to predict the future is to shape it, as they always say. Because as was already said, patient engagement can actually enhance ESG performance in many of its dimensions, not just when it comes to a clinical trial protocol. And the good news, next please, is that I know after 3 decades in pharma will adopt this. This did not come from pharma. Let's be very clear. This is an obligation that came from outside pharma, but that was the same thing for many obligations, whether it was financial reporting, compliance, digital, patient engagement, but pharma has a history of adopting very well over time. Next slide. I'll talk a little bit about that because that's what it's very important. ESG adoption, which will happen, is in fact a change process. And if you want to influence that and shape it, you need to understand a few things. First thing, next, is that you need to understand that there is a change process that always happens. Whether you are launching a new compound as a company, or an advocacy campaign as a patient organization, or a new product as a medtech or digital company, you will always need to first let your audience know it exists, awareness, then make sure that they understand why it's different before they can commit and then action. Need to know where you are and where your company is. That's the process. The second thing, and this is something we often forget, especially when we're in advocating roles. Advocating, we like to talk. The point is you need to first find out to whom to talk. You need to know who the people are in your company. And at this time in most companies, the ESG group is a little group in headquarters, corporate, somewhere high up in the tree, very far away from the patient engagement that happens on a daily basis. You need to find that out. And last but not least, next one, is you need to know the value. Before you can go and talk about patient engagement, you need to know how these two concepts, patient engagement and ESG, connect and how they can best connect to create for your company the best rating and therefore the best value. Next slide, please. So you've already seen this matrix. I could tell you very simply, in my opinion, this is why I'm so excited, patient engagement is ESG gold. What does that mean? That it is really valuable for companies to do better in their current ESG reporting and performance, which means they can ultimately get more money from you, which is very important. Next, please. So the key here is before you go in an advocating role and call your ESG colleagues, make sure you first get to know their perspective. As Joep said, I have a background as a physician who used to ignore the patient perspective. I was very much explaining what I thought. And the key of patient engagement is to first seek to understand the patient perspective. There's a whole methodology to ESG. There's a whole language to ESG. The better you understand this, in a better position you will be to engage with your colleagues. Next one, please. Once you understand the language, once you've established a relationship with your ESG colleagues in your company or your organization, no matter whether it's a company or another organization, then try to find a really concrete topic. For example, let's take clinical trials. If by listening to patients, you can reduce the number of visits, the number of unnecessary assessments, and even the travel time, you are helping your company by making a study that will probably run faster with less dropouts. But you're also helping the patient community for a large extent, and the planet, because there's going to be less emissions, et cetera, et cetera. So you could say that working with patients to improve clinical study protocols will be in the blue segment. Now, where in the blue segment will depend on your company, but I can guarantee you that it will be in the blue segment and more probably to the top right. And that's the case for several activities, up to you to find the one that hits the road the best for your company. Next one. And so that means that you have to develop, there's no general ESG story. It needs to be your story for your company. And that's very important because once you know that story, then you can start telling it. And that's next slide. This is just to give you an idea. If you, we'll send you the slides, and if you click on this image, it's a TED Talk, 30 minutes, that gives you a framework for developing that, what we call sometimes the elevator pitch, the story for your company. There's one here on the left, but it really is just an example. But work on your story. Next one, those in advocacy know that. Next slide, please. This is already my last slide. Next. All right, so this is where I want to go beyond pharma, because this is ESG is not yet for pharma. Yes, today for pharma, like for all profit companies, it's an obligation, right? So why is it important today for you as a patient organization to know that? Well, first of all, if it is that important to pharma and you wish to work with pharma, then it's important for you to understand that this is a new consideration in pharma. The better that you can help them to meet their ESG obligations, including by working with you, the better it is for you. So it helps you to expand and broaden your story. The second thing is there are other than pharma investors. You have the big philanthropists, Warren Buffett as a big one and all. But the truth is most of the people who are philanthropists made their money in business. And because of their business alter ego, they very much are aware of ESG. So if you now can bring them your not-for-profit story with an ESG sauce over it or an understanding, you have a bigger chance of getting money. And not just the big ones, but the individual, you, me, your uncle, your aunt. What we know today is that people, the younger the more, want to invest in what they call ethical investments. Ethical is just one dimension of ESG. There's already 1 in 5 American citizens that invest in ESG funds today, with 2 in 5 saying that they will do soon. So look how big this is expanding. It's going to be 60% of all financial investments soon. And that includes into your patient group. Last one. There's also on the horizon the fact that once this has become a little bit established in the for-profit sector, this will become an obligation also for the not-for-profit sector, right? So that's why also for you as a patient organization, this is very important. So in other words, I have 1 minute to close. I really believe we have a really opportunity here. ESG can help patient engagement, but patient engagement can also help different ESGs. Sometimes patients are the best people to tell you how, example, to reduce the waste of your product, because they use it every day. Well, waste is one of the key dimensions of E, the environment, waste reduction, right? So there you can actually work with patients in many dimensions. It's not just writing protocols. And the better that we work together to help each other understand this and adopt this language, the better we also help our ESG colleagues, our companies, our patient groups, our organizations. That's why I'm so excited. Thank you very much. I will hand it back to Haley, I think, because I was last.
Thank you so much, Loda and Joep and Nicola for the fabulous presentations. I think you have really helped to provide not only some fundamental information and content, but also help to inspire and think about innovative ways that we can progress forward with this collaborative opportunity as well too. I can see in the chat, there's a number of comments, and also in the Q&A, we have some questions as well too that we'd like to address. Before we turn to those questions, we have one more Slido poll for you. And this is just a reminder that for this Slido, you will need to rejoin again So adding the new code to this particular poll would be beneficial so that you can see this new question, which is, in one word, how do you feel about the collaboration between the patient community, industry, and the investment community in advancing patient engagement? We recognize this is a new opportunity, as we've said many times, that this is a pivotal point as well for patient engagement. There's a lot to learn, there's a lot to discover, there's a lot to understand from the different perspectives. But collaboratively and together, how can we progress this? And how do you feel about that? Does it make you excited? Does it make you hopeful? Does it perhaps provide some different perspectives in terms of curiosity? We're really looking to see what the reaction has been from these presentations. And so if I can ask all of you to take a moment, re-enter Slido and provide that new code and just share with us 1 or 2 words that really share how you're feeling about this opportunity. And then we'll quickly move to the Q&A as well too. All right, Diana, let's see how we're doing here. So you can see in real time as people are providing words, providing opportunities here, what's happening, what are some of the key words. So excited, inspired, hopeful, curious, a new opportunity, absolutely. There's a little bit of the curious there in terms of this being uncharted, a little nervous, a little cautious. And certainly, I think we all sort of provide that perspective as well, too, to say this is a new opportunity. And how do we progress? How do we move forward with this? And that's ultimately what we want to be able to engage with all of you on as well as we move following the Q&A into our co-creation session as well, too. So please feel free to keep entering in those words. It's very useful for our team to see the feedback there that you've shared. But for now, I'd like to turn to the Q&A, and there are a number of questions that have been entered that I'd like to pose to our panelists. And so with that in mind, let's talk about one of the questions that's been raised here by an anonymous attendee who said, don't want to create any controversy, but none of this is recent, and most of the top 10 have started to report on ESG, aka corporate social responsibility or sustainability, if not in the 2010s, if not earlier. And I think maybe I can ask Joep for your response to this question. And that's certainly keeping in mind that, yes, absolutely, corporate social responsibility, ESG, has been around for some time, and I'll let you speak further to that. But how does this look different from what you may have been working with in the past?
Yeah, I'm definitely happy to comment on that. Indeed, ESG criteria and assessment and everything has been around for some time. Also, I guess, because at some point, larger institutional investors started asking about these things and people were reporting on it. Now, what I would argue is that it's very rapidly evolving, in that maybe in the early days, you could just talk a little bit about what you do in terms of environmental impact, and you could talk about how on the governance side you might be looking to improve the ratio of women to men, things like that, which is all very important, but was also still a little bit basic in my opinion. I think it's become much more sophisticated in recent years. Like, for example, back to patient engagement, that is very rapidly evolving. The whole idea that if you are looking into a clinical trial protocol, you would actually ask input from patients about what matters to them, and then see, for example, as part of that study, can I run, let's say, a secondary endpoint analysis that measures exactly that criterion? All of that is very new, and it's definitely not yet widely adopted. There's quite a bit of interaction that we see from companies with patient communities, but sometimes it's really just with the hope to recruit more patients in your study. And I would argue that involving patients in a deeper way, asking them what matters to them, is highly relevant. Now, we see this in reality. Bear in mind, the companies that we typically back are not the large pharmas. These are pretty small entities, typically of some 50, 100, 150 people. And bandwidth and everything can be limited. And what we have seen so far by engaging some of the people I showed you on our council with these companies, they're like, okay, I didn't know that was possible. And it's not because they're not willing to. It's really a matter of bandwidth and also access to people who've done this before. In smaller organizations, that can all be quite difficult. The larger organizations, of course, have teams for this and everything. But I also feel, and then I'll stop talking, the smaller entities typically are also a bit more nimble. And what we see, fortunately, with quite a few of our management teams is like, okay, I understand that, you know, it probably makes a lot of sense to involve the patient community, and they're doing it. And this is great because at the end of the day, I think it's my conviction, it's our conviction at our firm, that if the products you develop are relevant to the patient community, that's going to be good for everyone. Bear in mind, at the end of the day, an investor is financially driven. So are we. Let me be very clear about that. We're not, let's say, in the purely impact fund. We're a financially driven fund, but we want to see impact. We frankly feel that combination is very powerful. And so our experience so far has been very positive in this regard. It's really about the content, Haley, of what people are doing, where the progress is rapidly accelerating, in my opinion.
Great, thanks, Joop. And I think you certainly provided some perspective there in terms of historically, and certainly looking at the different size of the organizations as well, too. Loda, from your perspective, can you add some additional comments or compliment in terms of what Joop had shared as well?
Yeah, with pleasure. I mean, I've had the luck of being in two companies in my last decade of work in industry, where indeed corporate societal responsibility was being fully launched and rolled out. But I need to make it very clear, corporate societal responsibility is not at all ESG. It's perhaps one dimension on content, that's what Joop said, but it's also more than just, it's also the how. You can very clearly see a company when they do it for the first time, what they do on the social part is still old CSR. And what is old CSR? It's treating patients as recipients. And so what you report is the money you give and the hours of time your employees spend. But it's not about working with patients to create a better protocol. And that's the next thing. And it's the same in every dimension. Look, when you go to the environment, the old thing is that it's three things: energy, water, and waste. How much energy do you use? Yes, but how much of it is green? That's the next level, right? How much of it's recycled? Same with waste. So it's actually a very fast evolving story where we go much deeper. And it's a huge simplification to say that corporate societal responsibility is the same as ESG. ESG is much broader. It's directly linked to the global sustainability goals of the United Nations. It's actually the translation from a state level to an industry level of something that's a global commitment. And they were only published in 2015. Before that, CSR was a lot about looking good by giving and by working. And I was part of that. So I'm not saying it was wrong, but that was the level of our understanding. Like Joop said, we weren't really there to work with patients. We're now into a whole new ballgame.
Thank you, Loda, for that, and for the explanation as well in terms of the relationship to the UN sustainability goals and providing some more context around that. We've heard from Joop and from Loda, particularly around what the impact here is and the potential is for industry as well. I'd like to ask Nicola as well, from your perspective, there's a question here as well around understanding how does ESG and sustainability strategy of a industry or of a pharma company influence or impact patient organizations? Is it of interest? Does it impact the decision to work with a company or not? What's the value there for patient organizations to be further engaged with this ESG conversation?
A great question, Haley. I would argue it very much does, because it does elevate the patient's voice even further in the life cycle of medicines. It positions patient organizations as key players in achieving sustainable societal change in this circular economy idea. It can also provide a structured mechanism for measuring and improving patient engagement as a priority in the framework of an ESG sustainability strategy, so much more attention, much more emphasis, and it enables the patient movement to influence the investor community. And this relationship, I believe, as we've heard earlier, if properly harnessed, will lead to more valuable innovation based on the goals and outcomes that really matter to patients at the end of the day. But I agree with the comments earlier as well. It's a big shift from corporate social responsibility. There is the SDGs, of course, but also if you look at the European Union, the backdrop, the landscape is wholly different in terms of the Green Deal, for instance, and some of the legislation that's in place at European Union level on ESG reporting.
Yeah, Nicola, and I think that's something we've discussed before and would be interested to hear. It's come up in some of the questions as well, too, around some of the regulations, some of the requirements that will be put in place that the EU is considering or moving forward with, I should say, for 2024, and the impact that that has as well. Would you like to comment a little bit on in terms of how you might see the influence of those regulations and what that means within this context as well?
Yeah, I'll give you a very honest answer. It's hard for me really to oversee that and then think about what the impact of that might be. It's probably a bit of professional deformation, but most power that I have seen in these the most powerful interactions are the ones that are very specific to specific projects, where you make an assessment, let's say, of a clinical program within a company, and then ask patients, is this relevant? What's standard of care in the setting and what could be added? To be honest, what then happens at for example, European Union level, it's a bit of an afterthought almost for us, because we're in the trenches. What we try to do is back things and be very involved, have patients to the extent they want to help, learn from them, listen to them, to what matters, and then back the most meaningful approaches. And it's almost, it's not meant disrespectfully the way I just said that, but that's the reality of it. So at the end of the day, honestly, I think there's very few investors who follow all of that. We are much more focused on, what's the role that we can play? And as an investor, we feel we should be part of the ecosystem, because frankly, the amount of investment we do, and also how demanding we can be of the investments that we do, I think that comes with a responsibility. And again, in this sector, what we develop in this sector is meaningful, it needs to be meaningful. So that's more where we are. So I'm probably one of the worst people to ask about some of these more broader ongoing things, because we barely, we'll see it when it happens and how it affects us. Until that time, we're more focused on getting things done in our portfolio and things that we're looking at.
Yeah, thanks for the transparency with your response, Joep. Appreciate that. And Lotte, perhaps you have further comments in terms of, from a regulatory perspective, in terms of the regulations that are coming out. And also one of the questions that was referenced as well is thinking about what gets reported gets audited first. And so what do the auditors know? What will they look for? What sort of consideration needs to be given from that perspective as well, too? Lotte, if you can respond to those.
Well, it gives you some unprepared thoughts. It's really part of the change process, in the same way as patient engagement itself is still finding its landing phase in many companies. In some companies, it sits under communications, in some it sits under clinical, in some it sits under a corporate function that's separate, etc. In many companies, it sits under medical affairs. Today, it's not very clear where this will end up, ESG. Will it become part of risk management? Will it become part of financial reporting? Will it be a separate function? What it will probably happen, which is usually how industry adopts something, is we'll go through a phase where it's a separate unit very high in the organization. Because once the executive committee understands how important this kind of reporting is to investors and to the reputation of the company, they want to make sure that it gets started well. And once it is started, then it will find a home somewhere. And there will always be a financial part, an auditing part, because it's about reporting. So it needs to be, you need to have in the same way as financial reporting, you need somebody to collect the numbers, but then you need an independent party to come in and say, these numbers reflect reality, which is essentially what an audit is. It's an independent pair of eyes checking your processes. So yes, there will be auditing, yes, there will be reporting, but where exactly it'll come out, I think different companies, like for patient engagement, will again make different decisions, but it will go through that phase of once the company really decides to do it, it'll have a very strong corporate phase, and then it'll sink into the organization in a way as it sinks into the DNA.
Terrific. Thank you, Loda, for your comments there as well, too. There's still a number of questions that have not yet been answered, and I certainly have a number of questions for the three of you as well, too. In the interest of time, we are going to move on now with the co-creation part, where we're asking the audience to roll up their sleeves and really help inform us as we progress forward. But with that in mind, as we go through this co-creation process, we certainly will have an opportunity to continue this dialogue and hopefully address some of the questions as well, too. For those of you that have added questions to the Q&A, please know that if we're not able to have a chance to respond directly to the questions in the session today, then we will follow up and certainly provide the response, and certainly willing to have a conversation to address those questions as well, too. So please keep adding them into the Q&A. And as we move to the co-creation session, then, as I mentioned, this is a time for you to really roll up your sleeves and help progress as we are moving forward. And with that in mind, it's really thinking about some of the work that is ongoing currently within PFMD and at the Synergist, and is thinking about, from the different stakeholder perspectives, how we do progress with this conversation. How do we make actionable and move forward to create that change and to really help to influence the work of industry, of the investment community, to better support patient engagement and better health outcomes for patients. And so the feedback that we received today is certainly intended to generate good discussion and good conversation with us in this meeting. But please know that the feedback that you share will be taken back to our working group, to our task force, to go through, see what the insights were that were shared, and so that we can help to move forward and progress with this conversation and advance patient engagement as well, too. Certainly, we'll share some information at the end of this session as well, too, if you're interested in getting involved. But for now, what I'd like you to do is move on to the next slide, Diana. Thank you. And then this is a tool that we have used previously in the open forum sessions. Many of you may be familiar with it. It is the use of Group Map, where we will have a number of questions and ask for each of you to input some responses. We can reflect on those, ask some questions as well, too. The best way to use Group Map certainly is with a computer, if you're able to do so. And we will leave the Group Map open as well for a few days following the event, if by chance you're not at a place that you're able to input some responses, but certainly would still like to contribute. We have shared the link in the, thank you, the link in the chat, so you can follow through with that. You will be asked for your email address and also to provide your stakeholder group that you're representing here today, and then we can move on to some of the questions in the Group Map. So if we can switch over to the Group Map, that's terrific. Thank you so much. And as we move forward, we'll just give a few people a chance to log on and contribute in terms of their stakeholder group. Maybe another 10, 15 seconds. And if by chance you are having technical difficulties or challenges logging on, please let us know in the chat, and we could certainly provide some support there as well, too. Okay, so hopefully most people now have had a chance to come on board. And let's switch over now to the first question, Diana. Thank you. So Diana will help us progress with this, move this forward. And as you can see in this Group Map, then what we have is the question at the top in the dark yellow. And the question is, from your perspective, what would be the benefits if the investment community considered patient engagement activities? So you'll see that there are 5 stakeholder groups listed there with an others component as well too. And keeping in mind what you are here representing today, whether it's from the patient community, from pharma and biotech, from medtech, from as a researcher, or perhaps as a healthcare professional, or as another stakeholder group. We encourage you to enter in and to think about, again, what are the benefits for your stakeholder group if the investment community considered patient engagement activities? And perhaps I should rephrase that and not say if, but when in the investment community considers patient engagement activities. So please take a couple of minutes to think through from your perspective. I can see that there's a few comments already in here as well too. You're welcome to like the comments if somebody's put something in already. Great, thank you. So within the patient community, I see that there's definitely a lot of likes for the opportunity to provide, and Diana or Matt, if I can ask you just to scroll down to that first comment. Yes, thank you. Opportunity to provide input in the early stages of research projects and help investors analyze the impact from the patient perspective. So this is really talking about engaging patients in early dialogue, in early discovery, potentially preclinical. And Nicola, I'd be interested to hear from your perspective what sort of response that cultivates for you in terms of patient engagement at an earlier phase than perhaps historically we may have seen.
Maybe, I mean, I think that's a great point, but I think maybe even taking it one step earlier, and perhaps investors and patient organizations working with industry, looking at unmet medical need and research prioritization at that stage, very, very early dialogue before we've even moved into thinking about molecule, etc. And then in that way, we'll really be able to home in on innovation where the gaps really are for different patient communities. I'd be curious if PEOF is doing any of that work right now with your Impact Council.
Yeah, I'm very happy to comment to that on that. Excellent. Sometimes you just have to, give your feedback in a single word. I fully agree with that, and because if you are too late, then you cannot make any more modifications. And what I've seen so far is quite a few initiatives and companies backing these initiatives are a little bit late. And so mapping unmet need, at least, from in my book, unmet need, as I said before, is really defined by patients who are unfortunate to live with a certain disease. And so, yes, definitely, to also answer that question, is this something that we bring up with our Impact Council? Absolutely. Because you have to imagine when companies present their story to me, they always try to convince me of the huge unmet need that's out there. And well, in many diseases, unfortunately, the unmet need is indeed very high. But then they will come with their solution to that. And is that really a relevant solution? Is that really something that addresses the unmet need as it is seen by patients? And that to me is a very relevant discussion that we try to do as much as we can. So I don't know if it's already time for that, Haley, but if you ask me like follow up for this meeting, whoever wants to engage with me in this regard, I'm here to learn. That's the best way of putting it. I'm here to learn. And I've been in a privileged position to already learn from quite a few people on the patient side, but I think I'm extremely open to it. And I'm very glad this pops up with a lot of support because it's very relevant to me.
Great, Joop. Thank you for that. And I think certainly there's a number of questions that have been raised, not only in the Q&A, but also as people are entering some comments here as well. And as you've suggested, certainly a learning process and something that we're all exploring and figuring out what are next steps, how do we move this forward. Loda, from your perspective, looking at a couple of comments within pharma and biotech, companies will be benchmarking based on patient engagement, and patient engagement finally becomes the true competitive advantage that we have all been talking about. Perhaps you'd like to comment on that, as there's a number of likes that have responded to that comment as well too.
I strongly personally believe in that, and I can tell you a personal story. I was asked to advise a company in the preclinical phase, Boston-based startup company, because we tend to talk about the big companies with even a patient engagement department, but the reality is, and this is probably also Joop's word, he said this is 100 to 150 people companies and smaller than that. So the startups, they're the ones most hungry for investment capital, and they're also the ones most blind to patient engagement, because they often come out of a very scientific background and they only look at the science. And so when this company enrolled me, they actually enrolled me to have my medical expertise first. But I told them the message and said, I was very blunt with the CEO and the head of R&D, said, your ultimate purpose is to own an island or a yacht, right? Because you want to sell this with investors to a big pharma if it works in phase 2 or whatever. And I said, yep. I said, well, then there's only one way to describe what patient engagement is. Patient engagement will decide whether you will have room for a pool, because it's the size. And if you in 5 or 10 years have a compound that scientifically looks good, but there is no patient data, none of the companies will pick it up and none of the investors will continue investing. Because today you need to prove that what you're doing is also relevant to patients. And the same is true for researchers in the company. So I don't think it's the only parameter. In one of my previous company, we would look at 3 dimensions of investment. One is financial projections, which is all assumption driven. Anybody in finance knows that with assumptions like statistics, you can prove anything. The second thing is scientific viability, which is asked the scientists. But the third one is needs assessment, right? Because if the finance goes wrong or the science go wrong, but you still have a need, you will find another way to fill the need. And you need all 3. So it's actually, instead of a double materiality, it's a 3 dimension. But that really was, and I believe that companies who guide themselves by that, and there are a few examples, but I cannot cite names here. Companies that do that, they do have a better future.
Thank you, Loda. Thank you for that commentary and for the example that you shared in terms of the unmet need. And I think that's what Nicola had referenced as well, too. We'll move on to our second question now. Thanks, Diana. And so this alludes actually to a question that was also posed. When we're thinking about the types of commitments or the type of metrics or the KPIs that investors should consider when engaging with the patient community, what are some of those, and how can industry leverage some of those metrics and commitments as well too? So you see there's a few comments here around the types of information, the types of commitments or the types of metrics that could be considered. Joop, you mentioned previously that you refer to a number of different measures or impacts that potentially from an investment community you're looking at. Can you comment on some of the ones that have been provided here, or perhaps provide some additional insights from an investment perspective? What are those impacts or those measurements, those KPIs that the investment community would be most interested in?
Yeah, so if I just look on the screen here, the one that jumps out with a lot of support is research priorities defined by patients, and that I fully agree with. As mentioned before, I think it's very powerful to really understand where unmet needs lie, rather than hear it just from companies or from medical experts. I think the patient voice is essential there. The other thing that is important, I think, is be realistic about what can be changed and what cannot be changed. Myself. What we have entered with Gilde, with our strategy, we see it as a marathon, not as a race. So there will be instances where we will disappoint, frankly, because maybe certain areas, and I'm thinking, for example, let's take something like antibiotics, that has proven to be a very difficult investable space for a whole bunch of reasons I don't want to go into, yet the unmet need is really high. And I would imagine if you ask certain patients, might end up high on certain lists. So there you need to engage and kind of explain as to why, from an investment point of view, that's a very tough area. So you have to be transparent. You cannot overpromise about what you can and cannot do. I can give you another example. If we back a company that is subsequently acquired by, let's say, a large pharmaceutical company, nobody at the pharmaceutical company will come to Gilda and ask, well, what were the priorities you discussed with the patients? It's out of our control at that point in time. That doesn't mean that we shouldn't follow our strategy, as long as, because there will be instances where this will work very well. As long as you're realistic, as long as both of us understand what we can and cannot do, the engagement, as I said, can be extremely powerful. There's no way I can read all these things popping up on the screen, Haley, but those are just some thoughts that I have. And defining research priorities, boy, I welcome that any day of the week if people want to engage in that.
Yeah, and that certainly seems to be one that is definitely gaining some momentum here with 18 votes or so to say that this is absolutely an opportunity here. Looking at also the type, frequency, quality of patient engagement activities. Certainly those seem to be the top couple as I'm doing a quick scan here as well. Looking else to see. Nicola, is there anything from your perspective that stands out here from the patient community and the impact that this would have for the patient community as you look to some of these commitments or metrics?
What's really nice from my perspective is to see the commitment to diversity, equity, and inclusion in terms of populations previously excluded from clinical trials, reaching out to underserved communities. And that, again, I think there are synergies with patient organizations out there as well, because they also find it sometimes difficult to reach out to underserved communities. And if there could be some collaboration in that context, I think that's going to be a win-win situation for everybody, because patient organizations, in terms of really been able to target some of their activities, individuals and communities who would really benefit from the information, the insight, or getting a policy document or position paper really nuanced with the entire community's perspective across the board, including unserved communities, is really important. So I'm seeing it from a slightly different angle, but enormously beneficial too.
Great. Thanks, Nicola. Loda, I see you have your hand raised, and I'm wondering, in the interest of time, is it related specifically to a comment that Nicola made or about this question, or can we move to the next slide and have you address your comment there too?
It's about this topic because it goes back to something that Joep said as his personal example.
Perfect. Go ahead.
Because as a nerd, I'm actually reading the question. I don't think that many of the answers relate to the question. This is about investors engaging the patient community. What should they look for? And as Joep said, its first thing is relevant. If the patient community is afraid and they won't use it, then everything else doesn't matter, even if the protocol is written with patients. And the second thing is group size. How much % of your population, of your patient group, could actually benefit ever from this, right? So I'll stop there.
Yeah.
Interest of time.
Yeah, that's great, Loda. Thanks for that commentary as well too. Let's switch to the final question now too, in the last few minutes. And so this question for all of you as well is, what can you, as a stakeholder, as somebody in attendance at this webinar, contribute to make collaborations between the patient community, industry, and the investment community a reality? So again, thinking about the stakeholder group that you represent, and what are the specific actions that you could take to be able to advance this conversation, advance the dialogue, and really think about the opportunities that we've discussed today too. So I'll leave that with you for just a few minutes as those people provide some input and responses to the group map here. And a related question that I have for Joep as well too is, specifically, you've shared with us a number of examples today that really illustrate and demonstrate the commitment from Gilda Healthcare to really listen to the patient perspective, understand the unmet needs from the patient community. Certainly, you're very active and involved in that. And I think you were very transparent when you said, you know, this was a learning for you, and that a number of years ago, this wasn't necessarily the perspective that you took, but obviously there's been some change, you've learned, you've grown and developed with this. My question would be, how do we encourage the other investors or other stakeholders within the investment community to further adopt this approach and really support and look forward the patient perspective and the community's perspective and what the unmet needs are? Any suggestions you can share with us there in terms of next steps?
Yeah, no, I'd be happy to, and take it with that notion that I said, this is a marathon and not a race, right? It's going to take a little bit of time, but the best way of showing this is by showing that it works. So what are case examples? What are investments that we are involved with, where we involve the patient voice, and there is, let's say, a protocol amendment, or there's a secondary endpoint added based on the patient input, whatever it might be, and actually that turns out to be very successful, and then a drug gets launched and it's actually taken up. Also, in all of that, there's a lot of things I said there in 10 seconds, but in all of that, there's little small steps that you take where you can interact, where you can try to complement each other. And it's very important that you do that and that you also celebrate these small steps. Communication with each other. There was a time, and look, if we were to do a poll, how many of you have ever invested with the investor, interact with the investor community? It's probably a small fraction, I would dare say, because typically that's what it is. And again, that's partly, to a large extent, that's on us, because investors have always been like in this little bit on the outside. We like our secrecy, things like that. I think, frankly, that it's about time that investors, including myself, and I can only start with myself and my own organization, obviously, but that we are part of this ecosystem. I'll give you one metric to think about a little bit. If you look at the amount of money invested by investors, it dwarfs the R&D budget of any large pharmaceutical company. Frankly, if you add the 10 largest pharmaceutical companies globally and you add their R&D budget, that starts to get close to what investors put in any given year. So even if you don't like investors, we have a pretty big say, particularly at the early phase, as Loda said, as to what gets developed and what doesn't get developed. And so again, with that, I feel comes responsibility. Now, we cannot do this by ourselves. We cannot do this alone. There's many perspectives that we cannot think of. I gave an example of some very powerful perspectives that can come from the patient community. Help us in that. I'm very willing to, and we as an organization are very willing to engage, because once this is being done and once people start seeing, well, wait a minute, actually this leads to, more relevant product development, maybe also more efficient product development. At some point, other investors will say, well, wait a minute, maybe this is the way to go. And I'm not patting ourselves on the back here. I'm just stating a bit of vulnerability that we cannot do this ourselves, right? So contribution, we're open. I'm very happy to speak to anyone who's willing to teach me a bit about patient perspectives. Of course, our Impact Council is a huge step in it, Haley, and these are some of the best minds that we could find who are assisting with us. I learn from them every day, but that's kind of my perspective on this.
Great. Thank you so much, Joep. Appreciate the insight there as well. And as you said, suggested, from experience, but also a collaborative opportunity as well to have the different stakeholders at the table. And I think what we have hopefully demonstrated to our audience today is that the investment community is a new stakeholder at the table as it relates to patient engagement that has not necessarily been considered to any great extent in the past as it relates to patient engagement. And there is a really great opportunity here to further engage with the investment community and think more carefully around how there is that collaborative effort between the patient community, industry, and the investment community as well to really help to advance and to really think about the evolution of patient engagement, to further integrate it into companies, to identify, as we've all said, that unmet need for the patient community as well too. So really looking at it from the value for the patient community, and as you have said as well too, Joep, in terms of what that means for companies, sustainability, and the investments there as well too. So we're out of time for the group map now, and I see many of you have contributed lots of great suggestions and ideas. As I've mentioned previously, we certainly will keep the group map open for several days, so please don't hesitate. If you think of new ideas, come back to it. Feel free to put your input in. We will certainly be going through this in great detail, the feedback that we have received. We will share with you a summary as well from the group map to share with you the feedback and the insights that we've gathered, and also let you know how this will be incorporated into the work that we're doing within PFMD, and specifically looking at the initiative we have underway as it relates to patient engagement and ESG in the investment community as well. If we can quickly go back to the slides, Diana, please. What I'd like to ask from our panelists now is based on the discussion, based on some of the input that you've seen from the group map. I'd be really keen to hear, one or two key takeaways that you have from our discussion today. Perhaps it's a new insight, a new learning, a new perspective that you might take away to your roles and to the work that you're doing as well. So, Nicola, can I turn to you first, please?
Sure, Hayley, very briefly. I mean, I've been blown away by the last hour or so. The strong interest and energy in ESG per se from the word cloud, obviously excited, inspired. That's great basis to start from. Europe's company is a real model for other investors, really committed to the patient's voice. I think this phrase of Loda's patient engagement as ESG gold really resonated a lot with me. The importance of the ESG narrative that's customized for every organization or company. And finally, ESG is a change process requiring really careful change management, but also the patient organization's legitimate role in all of that, I think came across very strongly.
Great, Nicola, thanks so much, and really appreciate your participation and contribution to this discussion as well, too. So thank you for that. Joep, your turn, please.
Yeah, it's been fantastic, and one of the things I will do is I'll go on the maps, and there's a lot of things that popped up that I didn't read quickly enough, and on one of those I'll definitely take a look at it and think about these things a bit more. And I'm sure I already saw it. There will be some ideas that we never thought of, and those ideas can be really good. So I'm very excited to see the engagement, like you and Nicola. It's really quite something to see that. And look, at the end of the day, I'll admit one more thing. We at Gilde, we don't exactly know how all of this is going to play out in the next few years. We don't. What we do know is that we'll need, critical thinking and support where we can get it. And you've already shown, the participants, you guys have already shown that you can come up with ideas as in these mind maps. It's a very good idea, by the way, Hayley, to have done that. That there will be things that we cannot think of, so please keep it coming. I'm very happy to help in any sort of way that I can. At the end of the day, it's simple. We at Gilde have a firm conviction that, again, investors, we play an important role and we should play it. So with support and with some of the creative thinking around here, you've given me a lot of energy. It's been a very good discussion, and thanks to everyone who participated in it.
Fabulous. Thanks, Joep, for sharing the feedback and your insights, and certainly a pleasure to have you part of this discussion as well, too. I think, as you've mentioned, some learnings on your part and learnings on our part as well, too. It's going to take the collective effort to better understand and to be able to progress this and move this forward. You very kindly said as well, too, that if there's opportunities for learning with patient engagement, and I think any number of our panel or the participants as well, too, would be, happy to provide some additional support moving forward with that as well, too. So really looking forward to continuing our dialogue and collaboration as well. Loda, can I turn to you last, and again, not least, but interested to hear your key takeaways and concluding remarks as well, too.
Well, I'm not going to go in any detail because I think Nicola and Joep summarized it very well. So I'll go back to what I think is this is about change, right? Mm-hmm. Don't be afraid of change. In general, whatever the change, those who embrace the change proactively are usually end up being the winners. Right? The best way to predict the future, as I said, is to help shape it, because we will all be at the table of the future. Either we're at the table or we are on the menu, but we decide. Thank you.
Thank you, Loda, for that. And thank you for your contributions and participation with this panel and for the discussion as well, too. I think you've provided a lot of really inspiring and innovative ways of thinking about this perspective. So thank you for your contributions as well, too. I think we would all agree that this certainly has been a very dynamic, very innovative session, and really looking forward to continuing the conversations as well, as we have all agreed that this is change. There's change coming, but it has a great opportunity and really a positive impact for patient engagement moving forward. to all of to Loda, to Joep, to Nicola's comments as well. It's how can we work collectively, collaboratively to shape this future and to learn from each other and progress in terms of thinking about ESG and the investment community moving forward. So I thank all of you as panelists. I thank all of you, for the audience and the participants, for contributing to this session, and really looking forward to continuing the dialogue. On the next slide, you'll see very quickly that we have a QR code that if you are interested in hearing more information about the work of PFMD, how we are evolving this initiative, please do feel free to get in touch. Send us your email. We'd be happy to have a conversation and follow up with you as well too. And this certainly is not the end of the virtual open forum sessions. Many of you may already have registered, but if you have not yet, there is another session later this week that you'll see profiled on the next slide. It's specific to building the bridge from pharma to medtech with patient engagement. So really exciting to hear more about the progress of the medtech space within patient engagement. Encourage you to attend and participate as well too. And then also thinking about some other exciting news that, again, many of you may have seen through social media, but we have a great opportunity here as well too to introduce a really new initiative called the Made with Patients Award. This is an opportunity to celebrate and highlight patient engagement champions and initiatives that go above and beyond their effort to put the patient at the center of the health ecosystem. A lot of what we've been talking about today. So the submissions will be evaluated by a multi-stakeholder group of experts, and the winners will be announced during our in-person open forum session in June. And please note, as you're thinking about this, we're not looking for the perfect initiative or the perfect champion, but those that have a relentless dedication to advance patient engagement globally, and even thinking about the learnings that may have come from this as well. So we think that all efforts deserve to be recognized, and so don't hesitate to make yours to be known as well too. The submissions for this year's award is on May the 20th, and so we really encourage all of you to contribute and participate with this activity as well too. So again, thank you everybody for the panel, for the contributors. Really a great session today, and look forward to speaking with you all soon. Thank you so much. Enjoy the rest of your days.